As we age, the weight-bearing joints, particularly of the lower limbs, such as the hip and the knee, become worn and torn, or wear out basically as a result of the loads that are put on them during our life. And as this happens, joints will become painful and swollen, their range of movement will become restricted. And if you get to the point where the pain and the dysfunction from this wear and tear process gets and stops you from being able to live your life, then your surgeon, who is an orthopedic surgeon, will tend to think about a joint replacement. Joints that are commonly replaced are the hip and the knee joints. Less commonly, we need to have interventions in the lumbar spine, but very common are hip and knee replacements. And when we're talking about the knee joint, we're talking about having the weight-bearing surface of the knee replaced. So the lower part of the leg is called the tibia, and this is the femur. The important things to consider are that once the joint surfaces that are arthritic have been replaced, you'll be left with a knee that is very functional in terms of the joint, but what will be needing rehabilitation is the muscle system. So we talk about the quadriceps muscle, which run down the leg and attach into the kneecap or the patella. We talk about the hamstring muscles, which come down the back side of the leg and attach below the knee, as well as the calf muscles, which run down the lower part of the limb to the foot. And so joint replacement surgery is a very good way to being able to being more functional and have less pain. But because knee replacement and hip replacements only last for 10 to 15 years, it's very important to make sure that you see a physiotherapist to determine what exercises are applicable for you, both before surgery to strengthen the muscles of the quadriceps and the hamstrings, which would be at the back, as well as the calf muscles, as well as post-surgically, you would need to learn how to use that new joint in the optimal way. It's very common for patients to develop means of compensating with an arthritic painful joint, so they perhaps walk differently or learn to weight bear differently. And so it's the physiotherapist's responsibility to educate them about these dysfunctions and help them to become more functional and lead a pain-free life again. A common concern for patients considering joint replacement surgery is what their activity levels will be like post-surgery. And so it is possible to participate in many different types of sport. Usually the considerations that the physiotherapist will need to take into consideration are things such as overall body condition and muscle strength around the joint that's been replaced. So it's a really good idea for you to discuss this with your local physiotherapist and determine an action plan to being able to get you back to the sport that you love.